Hi, I'm Dr. Ryan Lawless. I'm one of the general surgeons here at Orlando Regional Medical Center. Come on in, I'm going to show you around the operating room. I'm going to take you through a laparoscopic cholecystectomy, which is the removal of the gallbladder. This is just a mock, but rest assured that when we do this for real, this is all sterile. Laparoscopic cholecystectomy is one of the most common operations that I perform, and it's one of the most common operations that we perform at Orlando Regional Medical Center and actually Orlando Health on the whole. All of the instruments back here are things that we use in order to take out the gallbladder. In order to enter the abdomen, I typically use something we call a Verus needle. A Verus needle helps me introduce the carbon dioxide gas into the abdomen. That's what creates the big area that I can operate in. We then put ports in order to guide our instruments. A 5mm port allows me to access the abdomen, but also take any instrument that I need to use to slide into the port and into your abdomen in order to interact with whatever organ we're taking out. Different instruments have different shapes, and those different shapes allow us to either dissect or move tissue out of the way, or actually hold on to different parts in order to move it the way we want it to. We call this one a wavy grasper. I'm sure it has other names, but I call it a wavy grasper because it's wavy. And so I can grab onto the gallbladder itself and I can move it around. We also have a larger port. And this is the one that I place just above your belly button. It has to be bigger in order to accommodate the size of our cameras, which are a little bit larger and allow us to see on the inside. Also, we have to get the gallbladder out somehow, and we'll take it out through this larger port. Anything that's blue is sterile. So we don't touch anything, we don't breathe on anything, we don't interact with anything that's blue unless we're fully gowned and gloved. Before we enter the operating room, we have to clean our hands, just like they do in the movies. So we have a small scrub brush. Time to go get dry. Now we're ready to go. So we're going to show you how we drape out a patient. So we start off by making a square. And we know that we've already prepped this area. And next comes that big drape. And this is the entire part of the abdomen that we get ready to operate on. One of the special instruments that I use in order to control everything in the abdomen is what we call an endoscopic clip applier. This allows me to put clips onto blood vessels and also specifically for this operation, the cystic duct. And that's that duct that connects your gallbladder to the rest of the body. So the camera is just inside this, but in order to magnify everything and to be able to point the camera where we want it to go, we have to hook up this long lens to it. And what this allows me to do is almost look around corners. So I make an incision just above your belly button here, a second small incision up top here, and two other incisions, one here and one down here. The 12mm port goes right here. One of the 5mm ports goes here. The second one goes here, and the third one goes over here on the side. So after we blow you up with air, your belly kind of sticks out to here. And when we put that camera in, I can aim it up this way towards this right upper side. And that's where we'll find your gallbladder, and we'll kind of push it up to the side here and be able to find the structures that we need to in order to take it out safely. The group that helps take out your gallbladder includes the surgeon. Often we have an assistant, whether that's a resident or it's an advanced practice provider or a registered nurse that's on the team. We also have our scrub techs that help us to clean the back table, to get everything organized, to hand us the instruments that we need. And oftentimes they are anticipating the next part of the operation, so they are right and ready with the next instrument. We also have our circulating nurses to help get the patient positioned, get them under anesthesia. Up on this side is where the anesthesiologist and the nurse anesthetist will be to help make sure that the patient goes to sleep properly and stays asleep during the operation. And this is the anesthesia machine that uses the different gases. They also have all of their medications that they can give through the IV in order to induce anesthesia and maintain anesthesia throughout the entire procedure. Doing all right under there? A very important part during any case, and actually before any part of the procedure is performed, is what we call the timeout. A timeout is where everything in the room stops and we all focus on the patient. Do we have the right patient in the right setting, doing the right operation with the right equipment? The timeout itself is a big marker of safety and is something that we do to ensure that all of our patients are having the right operation on the right day with the right surgeon. In laparoscopy, we do have the surgical lights on until we get into the abdomen. Once we get into the abdomen, we turn the OR lights off over our head, pretty much because it causes glare on the screens. What you can see is that we have these LED lights that come out through the tip of our scope. And so this way we can see what's going on in the abdomen. We have the screens that are all lit up and we're operating through the screens themselves and focused on what we're... This was just a little glimpse behind the curtain into the operating room for when we do take out someone's gallbladder or we do any operations in the operating room. I hope I was able to answer some of your questions. If you are having issues, please come see us.